A lot of time I see patients coming here with being having treatments for yeast infections for many, many, many times without any relief, and they still say that it's itchy, burning. And in the end, when I check the patients, it could be or just because of the atrophy or the dryness, and sometimes, like I said, because of some products they use, some habits that was not giving problem in the past but now create some inflammation, irritation that cause the burning sensation, irritation that can be really annoying for patient. There is treatments to do. Like I said, since it's a chronic disease, usually we need long-term treatments to help. There's always like a gradations of treatments. When we talk about the vaginal atrophy dryness and that cause mostly of dyspareunia, the first thing, it's usually lubricant that you use when you have intercourse. The most effective lubricants is a silicone one or the plain old olive oil that you can use, coconut oils, anything like vegetable oil, something like that. We cannot use oil on lubricants if you need to use condoms for birth control. If, for example, you're not menopause yet, because we can see vaginal dryness also in postpartum state if you breastfeed. So if you use condoms, they can damage the condoms and not make them as effective. So silicone is better than the water base, which is kind of funny, but sometimes create more dryness and more tear. Because sometimes patients can even relate having some tear at the entrance to the vagina. So lubricant is the first step to use silicone or oil, like I said. And after that, there is moisturizer. Same thing, you use moisturizer for your skin. There is moisturizer for the vagina. And the moisturizer, there's a different one on the market now. There's products like Replans that is really old. There's products like Gynatrof that you can buy in any pharmacy or even in Amazon. It's hyaluronic acid and vitamin E, which is used in a lot of skincare products. And there's different one that can be prescribed, like Repagin, also Yalfem. Be careful to not use any products with scent in it, or any that I didn't recommend like that, because a lot of products now are over the counter, contain a lot of chemicals, scent, and increase inflammation and irritation. So we have to really be careful of what you put on your vulva and your vagina. One that I disrecommend a lot is Vagisil. Vagisil create a lot of inflammation and irritation in many, many patients. But for moisturizer, like I said, the most common that you see over the counter is Gynatrof Replens. They need to be used consistently to be effective, not just pinpoint when you have intercourse, and about 2-3 times a week. After that, we get more in the oral treatments. And on the market, we have now that we can use estrogen. We have a pill form like Vagifem. We have a cream like Estrase or Prevarian cream. We have a ring that can be used in the vagina for 3 months called Estrin. And since about a year and a half, we have another cream, or it's like a suppository that can be inserted in the vagina called Prasterone or Intrarosa. All those products need to be prescribed. And usually, after assessment of the patient, discussions of which form they prefer and what's the advantage of each, we decide for trial treatments. When you do trial of treatments, most of the vaginal treatments, even the one you use over the counter, you have to give a good 2 months to see some improvement, even if used like every as recommended. And a good trial of 2 or 3 months is usually needed to see if it works or not. After the hormonal treatments per vagina, which is usually the local one that are more effective, we have also now, since 2 years, a pill called ospemifene, and that pill is taken by mouth specifically to help vaginal dryness. It's worked really well, and for some patients that don't want to have vaginal treatments, that can be a ways to go as also. In the end, laser is a possibility. It's not yet Health Canada approved. They still wait for long-term results. But short-term results that we have is really effective to decrease vaginal dryness. It's usually a series of 3 treatments every 6 weeks, 4 to 6 weeks. And then usually you need to have a touch-up or another treatments every year and a half, year and a half. Depends on each patient. So again, it's not a permanent treatment, not cover, and it's around most of the places will ask you about $3,000 around that for the first 3 treatments. The laser can help also for stress incontinence and a bit of urgency also. So that's the benefits. Like I said, Health Canada wait for more long-term consequences or risk. But the laser, it's the one that is used since many years for skincare treatments. It's used now for a few years already by many clinics in Canada, and there's no significant problem. But again, it's not covered and it's quite pricey.